Hi there, I'm Leah, and welcome to the House of Hormones podcast. Dr. Ed, welcome to the House of Hormones podcast. Thank you so much for joining us. I know how busy you are.
Oh, thank you so much for having me. It's an absolute pleasure to be here.
So for anybody who doesn't know you, obviously I've just done an introduction, but let's hear it from you. Who are you? What do you do? And what are your expertise?
Oh, thank you. So I'm, as you said, Dr. Ed Robinson, and I am an aesthetics doctor with a clinic based in Hale, which is in Cheshire in the north of England. And then I also have a residency in London on Harley Street, which I do sort of once or twice a month. I primarily do non-surgical aesthetic treatments. So that's a combination of injectables, skin treatments, devices like laser resurfacing and things like that, as well as a heavy focus on skincare as well. Primarily, most of my patients are between the ages of 30 and 60. So I treat a lot of men and women, and menopause is a really topical conversation at the moment in terms of the patients that I treat. And additionally to that, I have another role. So I also work for the NHS as an anaesthetic doctor. And in fact, actually yesterday I was covering labour ward doing anaesthetics. So that's things like epidurals for labour, and then spinals and general anaesthetics for cesarean sections. So, and my anaesthetic work heavily influences my aesthetic work as well. So I've got a lot of different ways of making my procedures, less uncomfortable, as it were.
That's so interesting, actually, that you've just said that. So I had an epidural with my first son. My first child, my daughter. And there's an Instagram going around at the moment, like a meme, and it shows the size of the epidural needle, and it's like women are superheroes. When you see the size of that needle,
Yeah,
it's shocking.
I have to. There's a couple of interesting points to that, and I could talk about anesthetics for an awful lot as well. And I know I'm here to talk about aesthetics, but the one factor that I definitely notice with men is that they have a much lower pain threshold than women, and they really struggle even with tiny needles. But women just crack on with these very large epidural needles, and we obviously it's good that we're doing it to your back so you can't see them. But actually, the people that you have to be the most concerned about when you're doing these procedures are the partners who are in the room, because if they catch sight of the needle, sometimes they start looking very, very funny, and you can easily end up with two patients that way.
But like we're laughing about this. This is such and I am laughing. I think it's hilarious, but it's such a real topic. Like we hear the things like you hear period pains are the equivalent to a heart attack, and so that's a really interesting point that you've just noted. From your experience of years of being a doctor, you were saying women do have a higher pain threshold.
That's certainly my experience in general. And I mean, so many women go through the labor process, and especially if you have any kind of augmented labor, so inductions and things like that, which are becoming increasingly common these days. I don't know how they all do it. It's I think there's some inherent evolutionary mechanism that gets triggered after you give birth that makes you forget a lot of the discomfort you've been in, because it's a really, really painful process, and women just crack on and get on with it. Obviously sometimes with a little bit of help in terms of pain relief, but I've got a lot of admiration for women and their ability to cope with pain, that's for sure.
Wow, that's so lovely. It's always lovely to feel validated, I think, as a woman. And it's really nice to hear it from a man as well, and to hear, you say that. For some reason, validation just does help the whole situation. Do you know
Yeah.
what?
No, absolutely. So you feel heard. It's really important.
It's really important. And to hear that from you when you're physically working in that environment, and hear that from you, that it's just really great. So let's talk glow up. Okay, I want to really dig into this today. I'm really excited because I don't know loads about this area. If we were talking about hormones, I could sit and tell you everything, but I don't know much about this, so I'm here to learn. So in your clinic, what are the current in-demand treatments? You mentioned menopause there, but overall, what are the most in-demand treatments right now, and what's actually worth the hype and what's not?
Oh, absolutely. I can really talk about this for a very long time. But the we are first of all, I think it's really important to just be aware that in terms of non-surgical aesthetics, there are two kind of arms to it. So there is a feature enhancement, which is sort of which is subjective, and that's the concept of making people prettier, as it were, and giving you a more like enhanced, whether it's cheekbones, jawline, things like that. And that's one arm to aesthetics, and probably what I do a little bit less of. And then there's the other arm, which is anti-aging, which is about making you look like yourself, but like yourself when you were a little bit younger. And I'd say about 80 to 90% of my procedures would fall into that category. And that's always going to be different depending on the practitioner. But the kind of treatments that people are really looking for now are ones that are going to have a subtle rejuvenative effect on your face, keeping you looking like yourself. But really, the sort of comments people are looking for are like, "Oh, you look well," or like, "You look like you've slept really well," and the sort of treatments where people aren't going to be able to tell that you've had something done, and that's probably the most common theme of what I'm seeing at the moment. Um, and as a result of that, there's a heavy focus on improving skin quality rather than changing the shape of your face dramatically.
So what? Okay, so I have a lot to ask
Yeah, go
here.
for
Right.
it.
Okay. So I'm just going to be completely honest. So I
Mm,
have been considering Botox. I haven't had any. I'm also learning about polynucleotides, and I'm sure you'll
yeah.
tell me more about this. Why do people want, because the question in my head was, if I do have Botox, will I
Mhm.
tell people I have Botox? So why do people want it now to be so natural? Is it because they don't want to tell people they have Botox? And why is there so much stigma attached? I mean, I could go on and ask 100 more questions, but
Yeah.
let's just try and leave it on that one for the minute.
I think there is still quite a heavy stigma around having injectable treatments, and it's lessening. These treatments are becoming more and more popular. Sometimes I almost wonder if there's a bit more stigma coming back because the UK is in this bizarre position where anyone is able to do these treatments, so you don't have to be medically qualified to do them, which absolutely blows my mind. Is that could be a whole podcast in itself.
Yeah.
And as a result, as this is becoming more known, and that sort of these non-medical practitioners are doing these treatments, and some of them in a sort of relatively questionable way, there's almost more of a stigma surrounding it that's coming back in, and there's a lot of push for regulation in the aesthetics industry to sort of regulate and oversee how these procedures are being done. Um, in terms of people not wanting to tell not wanting people to know that they've had nothing, I think people just want to look like they're aging as naturally as possible and without any help. And so I can see why people would. And an interesting conversation that comes up quite a lot in my practice is even when a one person of a couple won't want their partner to know that they've had anything done. And so often they'll be like, "Oh, I can't possibly have a bruise because I don't want my partner to know." And it always tickles me because actually, I often find that partners never even notice anyway. Or one of the comments that they'll often bring up is like, "Oh, you look like you're in a really good mood," and it's like, "No, I'm just sort of not really frowning." So, that's,
And what are the main fears around? So for example, Botox. Like, what is,
Mhm.
because I try and think about myself, but then I'm also trying to think in terms of our listeners and people that are listening to this.
Yeah.
What are normally the main fears, and what can you say for those?
So I think the biggest fear that people have is looking overdone, is a word people often use, or just strange, or looking unnatural. And those are probably the three most common sort of terms of phrase people will use in terms of a fear of their treatment. And there's lots of interesting things to talk about that, but much of it is due to pictures that people have seen in the media, often of celebrities who've looked slightly strange. Um, and that can be for lots of reasons. Anyone can take a very unflattering photo, and there's a lot of money to be made by the paparazzi in taking bad pictures of people.
Yeah.
But there are examples of celebrities who have probably gone too far with cosmetic work, and those are the pictures that people remember. And I always say to people, well, you only see the bad work, you don't see the good work. So you don't see all the people who are walking around who've had these treatments who actually who look excellent. But that's the whole point. It's supposed to be undetectable. And I just always tell people you need to choose a practitioner who's going to do a consultation with you, understand how your anatomy works as an individual, because there is no one size fits all approach to these treatments. And something that your friend might have had good results for may well not be appropriate to you. And one really good example of that is treating the forehead with Botox. So you've only got one muscle that raises your eyebrow, your eyebrows, sorry. We've got a complex of 7 different muscles that pulls them down. And so if you just put Botox in the forehead, your eyebrows will drop. And if you're even someone who's prone to, if you're someone who's got a lot of tissue here, if we just treat the forehead at all, you have the risk of this happening, which can make you look more tired or even older. And so that, there's going to be complete treatment failure really in that case. If you're paying to look better and you look worse, that's, you've not really achieved what you were trying to.
Oh Lord.
Um, yeah, exactly. So that's really important in terms of like treatment planning and fears that people have, I think.
And do you think people are worried about it going wrong as well? I think that's one of my concerns is it going wrong?
Yeah.
But then I suppose that feeds into what you said earlier and the regulation around it and the fact that, you said you're shocked at the fact that anybody can do it in the UK.
Absolutely. And yeah, so there's a few interesting points with that. One thing that there's weird legal loopholes that allow the non-medical practitioners to practice with these treatments, and in many ways doctors or healthcare professionals are actually more regulated. So as an example, there are procedures called thread lifts. I don't know if you know about those. So that's when you basically use what we use in terms of surgery as stitches. So a suture effectively, which is threaded under the skin and is there to lift the face. And it sort of gives a fairly weak version of a facelift, which doesn't last as long. They can get really good results in some people, but they count as a minor surgical procedure. And now in the UK, if you are a healthcare practitioner, you can only perform a minor surgical procedure if you're in a CQC regulated clinic. If you didn't do that, you'd be struck off by your body, the GMC, the NMC, or the GDC for dentists. If you are a non-medic practitioner, it's completely legal for you to perform a thread lift on anyone wherever you like, because they have no governing body that they can be struck off from. So it's harder for me to do a thread lift than it is for someone who has no medical training whatsoever.
Oh
And
my
hearing
goodness.
things like that understandably put people off and make people nervous about having treatments. And you have all sorts of people who will advertise on social media and they'll put things like medic in their bios or whatever, and they're not. So you have to do a lot of research when you're planning who you're going to see for these treatments, and complications do happen.
And so on that, so obviously people can come and see you, of course, but if they're not close to you, what advice would you give to somebody who is interested in treatments? Like what research should they be doing? What should they be looking for?
So yeah, that's a really good question. And so you should do lots of background reading about the clinic or the individual that you're going to see. And I am a strong advocate for people seeing a healthcare professional for these treatments. And that means someone who is under a designated body, whether that's the GMC, so that's the General Medical Council as a doctor, the NMC, so the Nursing or Midwifery Council if you're a nurse, and then the GDC, which regulates dentists, that's the General Dental Council. And pharmacists also have a regulatory body as well. But ultimately, you want someone who's just got that extra experience in healthcare, that understanding of anatomy, physiology, and pharmacology, which is how all these medications and treatments work. And there's so many nuanced things that healthcare practitioners are trained in, which just makes them different to non-medical practitioners, in terms of hygiene, in terms of how you're carrying out these procedures, in terms of how you're documenting them. And, there's multiple medical legal aspects that have to be considered as well. But the crux of it for me comes down to most of the complications that happen. And complications do happen, whether you're going to a doctor or whether you're going to someone who's not a medical practitioner. They all require prescription medications to treat. And that might be, if it's fillers, it might be the emergency dissolving of fillers. It might be if you've got an infection, you'll need antibiotics. You might need steroids if you've got problems requiring, anti-inflammatories like an allergic reaction. And a non-medical practitioner just can't prescribe those things. So if you don't go to someone who's able to manage or ideally preempt these problems, you are gambling with your face effectively, or your body if you're having body treatments. And it's just a shame that that's the case. So it's going to a healthcare practitioner who's got a good background, who's got social proof that they're doing a good job. That's what I would look out for when choosing someone to go for these treatments.
That's such good advice. Honestly, it's really good advice that people can take note of that and go and try and research properly because
Mm.
my it's so important from what you've just said. My goodness, I didn't know half of that. You mentioned celebrities there,
Mhm.
and celebrities having work done and bad pictures and good pictures. So you were somebody who was known for working with really high profile clients and a lot of celebrities. What are some of the behind the scenes truths of celebrity skincare and things like that? Has your body ever done something weird or out of the norm? You've already went to the doctor, you've had your blood test, but you're still thinking, is this normal? Am I the only one that's dealing with this? Sometimes you just need to hear it from someone who actually gets it. And that's literally why we've created the House of Hormones Forum. Think your girls group chat, but with an upgrade. The House of Hormones Forum is a safe space with zero judgment and a strong community of women who really get what you're going through because they're going through it too. We're talking PMS, mood swings, cycle changes, cravings, all of it. And the best part is you've got real support with the House of Hormones Forum. So whether you just want to vent or you've come to ask questions, come and join us. It's given science meets sisterhood. So come and join the conversation at the House of Hormones Forum. We've saved you a seat. www.thehouseofhormones.com and just click forum.
Yeah, so no, I have treated a few celebrities, and that's it's I have a lot of fun doing my job. I really enjoy it. And the I would say again the same themes that we're seeing with all of our other patients is this high focus on skin, and people are moving away from having high volumes of dermal fillers and things like that now. So people want these subtle rejuvenating treatments. And I'm seeing definitely with celebrity skincare, I'm seeing a lot more energy-based devices being used, and that is things like laser resurfacing, radiofrequency microneedling, regular microneedling, and combining treatments with things like exosomes and polynucleotides, like you mentioned earlier, which are just it's this kind of concept of understated luxury. So rejuvenating the skin, getting your skin into the best quality as possible without these dramatic changes in our face that that people have been looking for before. And I think Molly May's documentary, I think it was an episode that's just come out, and she was talking about having her whole face dissolved. And that's quite a common theme that we're seeing with celebrities these days. With
Wow.
moving over to that higher focus on optimizing skin quality.
Yeah. And so I want to quickly talk about skin quality and hormones. So what do you see across the board with women's hormones and skin? What is the link?
So hormones are incredibly important in terms of maintaining your skin, and particularly with the aging process. So I can give you my little spiel about how the face changes with aging, if you like, and then sort of classify what the treatments that exist, how they work, and how hormones impact that.
We'd
It's
love
all
to
quite
hear your
depressing
spiel.
stuff, though.
We'd love to hear it. We'd
Yeah.
love to hear your spiel.
So the face effectively changes in three ways as you get older. So your muscle distribution changes. And what I mean by that is we have multiple different muscle groups in our face that are constantly, maintaining a certain amount of tension at rest and often opposing each other. And I gave an example earlier, which is that you've got this one muscle that raises your eyebrows. I'm not a very good example of this because not many of my muscles move much. But you've got one muscle that raises your eyebrows and seven that pull your eyebrows down.
I can do it. I'll do it for visual.
Yeah.
I could do it.
And as you get older, the seven muscles become stronger relative to the one. So we see a lot of people getting this progressive heaviness with their eyebrows as they get older. And another example that people get is you've got this muscle here, which pulls the corners of your mouth down, called the DAO. And that muscle gets stronger relative to the muscles that lift up your smile. So a lot of people notice this downturned corners of the mouth.
That's
And
me. I do. Me.
it's
That person.
And it's not a term that I use, but a lot of my patients will come in and say things like, "Oh, I feel like I have this resting bitch face," or "I feel like I look always angry or miserable all the time," and that's a term and a phrase that people use. And then the final area is that you have this muscle that does this, so it's called platysma, and it attaches into the corner of your jaw, and that muscle becomes a bit stronger relative to the ones that lift up. So we see this facial sagging basically, and that's all muscular distribution. The second way your face changes is that you get volume loss. So you lose volume in several different ways. You lose you lose volume from muscle bulk. And we often see that in the temples up here. So this starts to become progressively more hollow. And we also see volume loss in terms of fat pads in the face. So fat pads are actually really important structures for, providing facial cohesiveness and making you look young. And the most obvious fat pads are the ones that we have in the mid face here. We also have some around here in front of the ear and throughout the lower face. And those fat pads, as we get older, they basically split apart like icebergs breaking off from the poles. And then they follow gravity and then they drop over ligaments in your face like this, which is why we get these smile lines and these marionette lines that form here, because these fat pads descend. And then they also drop down here in between these two ligaments there, and you end up with jowling. And it's all very depressing stuff. But some of these fat pads get larger and some of them get smaller. And the ones that we want to stay large get smaller, and the ones we want to stay small get larger. And so that can cause a sort of facial sagging appearance. And then also, a lot of people don't realize this, but your skull changes shape quite a lot as you get older. So people know that the skeleton of an 80-year-old looks different to the skeleton of a 20-year-old. You lose bone density from your vertebra in your back, which is why you get shorter. You lose bone density from your thigh bones, your pelvis. But your skull is no different. So the eye sockets widen and the cheekbones lose volume, and this mandible, this jawbone here gets that atrophies, so it gets smaller. The maxilla, so the upper jawbone here, that has less support as well, and so that often manifests as the nose looking like it's getting wider as you get older, but it's actually got less bony support, and the chin does the same thing, so that also flattens. And basically, all these bones in your face act as shelves that stuff sits on. So if the shelf disappears, then everything drops off of it. So that's volume. And then the final thing is that you lose skin quality. So we lose collagen and elastin in our skin, and that causes increased skin laxity, and that contributes to this sagging. We also see lots of changes like, you might not have had acne since a teenager, or you might have never had acne, and then suddenly you hit menopause and you've got acne, because the way that your skin produces oil changes as well. And rosacea is another one as well. So these little thread veins, these blood vessels, or this flushing that happens, a lot of that is due to changes in skin quality, but also mediated by hormones. And so if we look at those three things, so your muscle distribution, your volume status, and your skin quality, all of those things are maintained by estrogen, progesterone, and testosterone. And as those levels decline, so that process is accelerated. And your genetics kind of determines how much of each of those categories you lose. Some people get lots of facial sagging, and other people become quite gaunt as they get older. And most of it is mediated by hormones. Your estrogen, testosterone, they're really important for maintaining your bone density, so the shape of your face, and really important for regulating the way the physiology of your skin, so the way you produce oil, which is why a lot of people get all these breakouts and things as they hit menopause.
So I think
that's
a lot
the long
of
and short of it.
No, that honestly, I should have had a notepad and be writing some of that down, because what I was going to say was, so out of those three, I think a lot of people know a lot about the third one, right? So quality of skin, collagen loss, we hear a lot about supplements and different things like that. So I feel like women are aware of that. But the first two, nobody knows really about this. And one question I wanted to ask you, so regarding kind of like the muscle mass and that type of thing, because you mentioned menopause, and so talking about perimenopause, when estrogen and obviously hormones start fluctuating and estrogens drop in, would you then say that HRT or replacing estrogen would then help that facial structure as well?
Absolutely. Yeah, it's completely true. So, most people are aware of HRT as being used to, mediate hormones and cope with symptoms of the menopause, and whether that's in terms of mood swings, things like that, hot sweats, and the other symptoms that people experience. But also HRT will improve the way that your face ages, because you are just replacing those hormones. And the closest you can get to physiological hormone levels, the less of that process is going to occur. And one of the sort of trickier things is that once you go through menopause, those facial changes have happened. And so if you commence HRT later, then a lot of those things can't really be undone. And so, lots of people have got different opinions about when to start treatment and things like that. But there is very good evidence that replacing these hormones can mediate and reduce the cosmetic effect of menopause and aging as well.
Wow. And that's what people don't know. So we all know about the skin and elasticity and collagen loss, but people don't really understand the benefits of, for example, HRT, or what just you've explained with your skull, with,
Yeah.
and just your bone structure on your face. That's amazing.
Exactly. And obviously, it's not just your face, it's your whole body as well. So, it's
Yeah.
going to maintain your bone density and your muscle strength everywhere. And losing muscle strength is one of the largest predictors of frailty as you get older. So it's really important stuff to be preempting and managing.
So can I ask you, because obviously we talk a lot about hormonal health at the House of Hormones, obviously, and we're talking to various doctors or other people, celebrities or people in the public eye who suffer from maybe PCOS or are going through perimenopause, and we talk about lots of different symptoms. And sometimes people might think, well, why are you having an aesthetics doctor come on? And it sometimes aesthetics is often portrayed as vanity and, things like this. In my opinion, my background is psychology. And so in my opinion, I see the mental health of women deteriorate so much as they're getting older. And a lot of that can be because of how they look, whether it's weight gain, because of hormonal fluctuations, or all the things that you've just taught us that we didn't know. Like, I didn't think of my face and my bone structure. I'm very aware of the effects of estrogen on bone health, but I didn't really apply that to my
Yeah.
face. But so in terms of, the things that you offer in your clinic and what do you do to the people? What do you say to the people that are negative about that, or that are negative to people and they say, oh, age gracefully, and because we're living for a lot longer now, aren't we? As humans,
Absolutely.
men and women, like we're living for much longer times. And like my argument would be, I mean, I haven't had anything done yet, but I'm not against it, is my
Yeah.
point. I'm just like a bit scared. So, but my point is, it's not about aging gracefully, or why can't everybody make their own decisions and make themselves mentally happy? And if that makes them happy, isn't it the same thing as wearing makeup or wearing a nice pink
Absolutely.
top today because it made me feel a bit brighter because the weather's bad? Or do you know what I mean? What's your opinion on that?
Yeah, so many things to unpick there. So I am firmly of the opinion that people can age however they want to. And having aesthetic treatments, there is a whole spectrum of things that would be considered aesthetics, from just advising people to wear SPF regularly because the sun is the largest driver of changes of aging in your skin, in your face, to advising people on lifestyle factors, which is prioritizing sleep, stopping smoking, cutting down alcohol, promoting exercise. So what I do goes well beyond just injecting people with Botox. And I think that's a lot of what people don't understand. I also spend a lot of time telling people not to have treatments too, because that sometimes is the right thing to do as well.
And can I just stop you there? Because other aesthetics doctors that I've spoken to, and I think we just need to double down on this, because the close relationships, just like you've said, that they have with their patients and the advice that they give to their patients, and actually sometimes they're the first port of call to even advise their patients to start HRT or to go to their GP and speak about things. And I just think, I know you've mentioned it, but we're kind of sweeping over. I think that's such a big point. Like, your job is so important, and people can't get appointments. I mean, on average, it takes women 10 appointments with a doctor to feel heard and actually maybe receive the treatment that they need, whether that's HRT. And often what I'm learning more and more about the world of aesthetics is how important doctors like you
Absolutely.
are, and the big role that you play in helping your patients.
Yeah, and it really does play a pivotal role, and there is more of a drive for holistic patient care in aesthetics now, because we know that I consider my role to be improving people's confidence. So how achieve there are lots of different ways to achieve that, and holistically approaching someone's health and well-being is just as important as performing injectables and skin treatments on people, to the point where we in the next few months are going to be introducing hormone replacement and menopause clinic in our clinic anyway, because it's such a crucial driver for the way you feel and also the way you look. And it's also an interesting point because you mentioned vanity in terms of these treatments as well, and it's really not what this is about. And there's a lot of misunderstanding about that. If I just think of patients I've treated in the last few months, I mean, not all of them are menopause related, but I've had one patient who was married to her husband for 40 years and was his carer for the last 3 years because he was very unwell, and then passed away. And she wanted some treatments to make her feel better because she didn't recognize herself anymore. And
Oh,
she didn't really know what life was like for her now that she had, her partner of 40 years, she doesn't have anymore. And for her, it was a huge confidence boost. And it's really not vanity at all. I've had a patient who she was an actress and she was going to her first premiere, and she'd had chemotherapy and mastectomy, and 3 weeks before this event, I did some Botox, a chemical peel, and some skin boosters for her so that it would bring back some of the glow that she'd lost from her, chemotherapy, which really takes a toll on your skin. And, I certainly wouldn't consider that vanity. I've had a patient who had a part of their skull removed for a brain tumor and then was left with this huge dent in their forehead. And they felt that everyone was staring at it the whole time. And she hated it because people would always ask them about it. And so she would then have to recount this cancer journey, which she really doesn't want to constantly have to think about and talk to people. So I did a small amount of dermal filler to remove that dent. So, and that's dramatically improved her confidence. So
wow.
really, these treatments are about improving people's confidence, how, whatever that might mean. And as long as people are doing something in a safe, effective way, with not, to minimize harm, and they're not hurting themselves or others, I really don't see why there should be any problem with that at all.
I think I agree with you, and I think the problem is the societal pressures that are
Mm.
put on women and men to look a certain way, and so therefore it does affect our mental health. The problem is not the fact that we have these treatments
Mm.
that can make us better, that's feel better. That's not the problem. The problem is the societal pressures that are put on us in the first place,
Yeah.
right?
And that brings me to another point that so I have it's not unusual for patients who are in their, or female patients who are in their sort of 50s or a little bit older, to come to me seeking treatments because they have younger female colleagues in the workplace and they feel like they need to keep up with them. And they themselves don't actually necessarily want these treatments, but they feel a pressure in the workplace to look young, because once there's this concept of once you're on your way out, and so they've got to keep up with the pressure that they have at work, which and it's a shame that that's how society makes people feel.
And that's how
Um,
women feel. But unfortunately, they do feel like that. And so,
mm.
and if there's things that you can do, I loved your point. And you said your job is, what did you say about confidence? Your
It's about
job is,
building people's confidence. Yeah,
yeah.
absolutely.
And I love that because that really resonates with me. Like I really understand it. And I just think a lot of people don't. And maybe some people might even see this episode of the podcast and think, oh, well, what's aesthetics got to do with menopause or hormones? And that's, people need to understand. I mean, you've blown me away with talking about the face, and because I know so much about bone density and estrogen, and you just don't apply it. So I think even just at that point, we've learned a lot. But I think people just need to broaden their horizons on this topic, because it really isn't it isn't always a vanity thing. Sometimes it isn't. Even
Mm.
if it is, what's the problem? Why is it anyone's business, right?
Yeah, exactly. And it always fascinates me where is the line drawn, because people you will get people who think that no one should ever wear makeup, but most society has generally accepted makeup as being fine. And people don't normally judge other people for having skincare regimes or having even in clinic skin treatments like chemical peels and facials and things like that. But as soon as a needle is involved and it's an injectable, suddenly, oh no, oh gosh, no, you can't. She shouldn't be doing that to her face. She looked great before and all of this stuff. And I always find it really interesting where that line is drawn and why people have decided that. And I think it's because of, as we said before, images that people have seen that put people off,
Yeah.
that are prolific in the media.
But I think as well it might be seen as like the lazy route, like you haven't
Yeah,
bothered
maybe. Yeah.
to, yeah. So it's like back to the thing of people will have it, but they want to have it where it's so subtle where they can pretend they haven't
Yeah.
had it. And if you have to pretend that you haven't done something, like,
Yeah, it's
obviously
true.
there's
But what's really interesting is when you say like the lazy route, which is what a lot of people would maybe think. I have very few patients who just have injectables. Most of my patients will be adhering to a skincare regime. They'll be wearing SPF every single day as prevention. They will have their lifestyle in check. They will be exercising regularly. They'll have done all of those things. And then the injectables really are the icing on the cake. They are the final 10%. If you don't have all of those aspects in check, if you're someone who smokes, uses sunbeds and things like that, then injectables probably won't work very well for you anyway. You're not going to get really good results from it. And I tend to discourage people from going down that route because you'll just get such better results if you do all the other things. And I don't think any of my patients are taking the lazy route. They work very hard to maintain themselves as well.
And I love that that's your kind of, core, because I think the House of Hormones, we come from a place of a holistic approach first. So before
Hmm.
any products, before any supplements, before any treatments, like it is about nutrition, exercise, sleep,
Absolutely.
stress levels. It is about all those things to help yourself and advocate for yourself. And you have to do that first. And then if you want anything else, if you want you know, grinding bed sheet, or you want it, whatever,
Yeah.
do whatever makes you happy. Um, so I just want to talk a little bit about, there's so much misinformation online. I bet this drives you crazy because obviously you're so knowledgeable and obviously you're, out there dealing with patients day to day and you have case studies. What's the biggest kind of piece of misinformation that you've heard, or what's one myth that like drives you mad? So, you've got a doctor's appointment coming up and you're just trying to figure out what the hell is going on with your body. You need our free symptom tracker. It's like the receipts folder for your hormones. You can track the bloat, the mood swings, the brain fog, the mystery acne, and then roll it all into your next appointment like a hormonal pro. No more being brushed off or told it's all in your head. You've got the data. Download it for free today from our website and start advocating for yourself. www.thehouseofhormones.com and head to our free download section.
I think, to be honest, it's mostly the thing that I'm recurrently seeing, some re-education conversations I see the most are skinfluencer social media regimes. There is so much misinformation from basically people who have no real background in skincare, but who have large followings on social media, advising people on what skin products to use, and almost all of them have affiliate links and therefore some kind of vested interest in promoting these products. But skincare and the skin is a really complicated issue. That's why we have dermatologists who devote in their entire career to looking after the skin, which is the body's largest organ. There's a lot of detail and there's a lot of nuance in terms of these products, but there's also a lot of money to be made from dramatically oversimplifying things to sell things to people. There is no one size fits all approach to skin products or having a skincare regime. Apart from SPF, everyone should wear SPF every day. If you want to invest any amount of money into your appearance, you should do that. But the products that I see people promoting really harsh retinoids, people that aren't appropriate, really harsh exfoliators that people must use because it's the one thing that you must add to your skincare regime to get glass skin. And it's just not appropriate for a lot of people. And I spend lots of time in clinic repairing people's skin barriers that have been damaged from products that they were recommended and bought off like TikTok shop because someone's,
Wow.
told them they should. And then that ties into the other thing that really irritates me, which is the concept of getting glass skin. I mean, no one has glass skin. That's not a thing. We all have pores. We all have skin texture, tone, and pores are important physiological part of maintaining your skin. And you see lots of pictures or videos on social media of people with these flawless complexions, and they're using beauty filters, or they've just put some oil on their face and now they're directly under a ring light, which obviously makes everyone look great, but that's not reality. And there are a lot of people who are desperately chasing this completely unachievable endpoint because it's just not real. And I was looking at the pictures or some of the footage from the Met Gala from earlier, well, from wait, what day are we? Like last week, this
Yeah.
weekend. And so many of the like very attractive, wonderful looking celebrities, they've all got skin texture, they've all got pores, they all have makeup that also cakes in their lines and things like that. And that's what reality is. And so people who are marketing and sort of suggesting that reality is any different, I find very frustrating.
Do you do that then? Like, obviously, because you work in this industry and you're doing a lot of the treatments, like, can you
Mm.
look at someone's face and say yeah, I can see exactly what they've had done? Like, do you do that to like celebrities?
Well, so
Like in your
I do.
head, I'm just saying in your head. I'm
Yeah,
not saying you're
I mean,
seeing.
I do it to everyone. I can't help it, and like,
Yeah.
I have this thing where I really struggle with people that I've treated, to look at any part of their face that is not the area that I've treated, because I'm sort of constantly like critiquing my own result. I was like, oh no, you must maintain eye contact, Ed. But but it's the same with everyone else. But to be honest, and I always find, I mean, I do quite a lot of press stuff as well, and I'm often asked for commentary on procedures that people have had done. And you just really can't tell. And I mean, you can tell if someone's had like a facelift sometimes, or if they've dramatically changed their appearance.
Yeah.
But realistically, if someone's had good work, that's the whole point, is that you shouldn't be able to tell what they've had done. You can tell if someone's got Botox because their face doesn't move very much. But beyond that, these skin boosters, these laser resurfacing, things like that, they're kind of undetectable. People just look quite good. And so it's really hard to say what someone's had done, but I do speculate quite a lot.
Oh, I love that though. I love how honest and candid you're being about that, because you see those videos, don't you, with people like showing two sides of their face and saying they've had this work done and that work done. And actually, what you've just said to us here is, as you're getting older and your hormones are fluctuating, your face changes naturally. So,
Mm.
realistically speaking, it's really difficult to tell because everybody's face is
100%.
changing anyway. So I love that you've said
Exactly.
that. And of course you're going to be looking at because that's your job, right? As soon as
Yeah.
as soon as we came on this podcast, you're looking at me thinking, she needs this done.
No, oh my gosh, no way. But maybe a little no.
No, but that's really comforting for women to hear, probably, because if somebody does want to have something done and doesn't want it to be obvious or to be judged, because as we know, people still do judge, and so if they want to, like, it's nice to hear from a professional expert in this field that actually it is hard to tell a lot of the time. So that's
Exactly. And what's uh, you can make someone's face look entirely different based on the way they've been lit as well. Like, just depending on where you put lighting and the position of a camera. I often tell people as well, when they bring selfies of themselves and they're like, I want to look like this, or I don't like the way I look in this picture. The front-facing camera of the iPhone uses a totally different lens to the back-facing one. So if you do a selfie, your nose is warped, your ears disappear, your face looks sort of distorted. And then if you turn the phone around and take another picture, your face looks quite a lot more wide set because the lens is just different. And your face looks dramatic. And I see this a lot often with fake before and afters online, where especially when they're demonstrating some kind of nose transformation, because if you use a different lens in the before and the after, the nose looks completely different, even if they've had a nose. Yeah, exactly. It's really, really interesting. And lighting is the same as well. So when you've got these side by side pictures of celebrities, you're like, well, they're lit totally differently. The angle of their face is different. Another one is, and I use this a lot, is if you sit to the side and have your chin like this versus if you sit like that, suddenly you've got a jawline. It's people use these deceptive pictures all the time. So when you come to comment on what some picture celebrities might have, it's like, well, unless you've got a standardized photo from one side to the other, how you can't really tell unless, like I said, it's a really
Do you
dramatic
know
picture.
what?
What I will say is speculating on what procedures celebrities have done is very good for your social media reach because everyone wants to watch those videos.
Yeah, yeah. But you know what's really interesting is, like, as women, we know this, right? So it's still
Mm.
frustrating that we still, and even me, so this isn't me like criticizing other people, but that we still are so susceptible to falling for
Mhm.
these tricks. It like it's really
Yeah, yeah.
frustrating because we know this. Like if I open my phone, everybody knows this. I know everyone in the comments will be like, ah, that was me. But you know, if
Yeah.
you open your phone by accident on the camera and then you look down and you're like, oh, and
There's
you
nothing quite as humbling.
there's nothing as humbling as opening your camera by accident. But we all know that we can get ourselves in a good position with
Mm.
the light and, you know, whatever. We can get a nice little picture on our good side. Like we know that. Everybody knows that. Yet we
Yeah.
fall for these pictures every time. It's
It's yeah,
not.
it's incredible because but you just want to believe that that's achievable. If you've got something that's affecting your self-esteem, you want a solution. You desperately want to believe in it. Um,
Yeah.
and
I want to
sometimes
ask
your
you.
starting point's just not based in reality.
Yeah. So one of the last questions I want to ask you. So we've all heard about baby Botox and
Mhm.
also tweakments, preventative tweakments. Is this legit or is this just good marketing? Have you been feeling like your hormones are running the show? Been there? Same. Our ebook is your no BS glow up guide to hormonal health. We're talking facts, expert advice, and real life hacks, all in one gorgeously written download. So whether you're dealing with PMS, perimenopause, or you're just tired of Googling what the hell is wrong with me, grab your copy now at www.thehouseofhormones.com and we've tagged it below. We've got your back.
So it's a bit of both. So I'll go through baby Botox first. So baby Botox is a marketing term, which just means using a reduced dose of Botox. And I'll just explain a little bit what Botox is and how it works for people who don't know. But it's a protein which is produced by a bacteria called Clostridium botulinum. If you eat it, it causes food poisoning or botulism. So we don't eat it; we inject it into the body instead. And what that does is it binds to the nerve cell that enters either the muscle or the skin. And the skin is relevant because we use it to block the nerve supply to sweat glands when we use it as a sweating treatment. But it reduces in a dose-dependent way the amount of the movement of muscle by affecting the nerve supply, basically. And it's not reversible, but it is temporary. So in most people who are having a fully dosed Botox treatment, it's going to last about 3 to 4 months, and probably all have worn off by about 6 months. So most people will be retreating at about 4 months. What baby Botox is just it's a normal treatment, except you use a lower dose, and that means you will have more movement, and it will also wear off much quicker. And so this might be suitable for someone who's maybe trying it for the first time and wants it to wear off quicker because they're not sure if they're going to like the result. Might be for people like actors or presenters who they might have contracts that say that they're not supposed to have these treatments, but they still want something. So it's going to wear off in time for whatever thing they need. Some people just want a lot of movement preserved and they want to look as natural as possible. But realistically, every treatment that you do for someone should involve a consultation and an understanding of what their desires are and how they want this treatment to work. So, I never really would market or discuss baby Botox because for me it's just part of a normal person's treatment, and if that's what their aim is, then that's what their treatment would be.
Yeah.
So that's kind of how it that's what people mean when they say it. It's not a different treatment; it's just the exact same treatment but with a lower dose because it's the placement of the treatment that affects the way you're going to look.
Yeah. And so you mentioned there, you know, celebrities might have it in their contract. Is that a thing that you see? So you might see.
Yeah. Well, so some actors and things like that will it being able to fully express yourself. I mean, at the moment, I've recently had mine, and I'm not really able to move my eyebrows much at all. But you know, if you're an actor, it's and you'll often note, well, I obsessively look at everyone's forehead when I'm watching TV and stuff like that. But the most actors will have full range of movement in their frown and around their eyes and in their forehead, because it's really important they're conveying those emotions fully.
So it's in loads
And
of actors' contracts that they're not allowed to get Botox.
Yeah, it will be, yeah, because you know,
Wow.
because they won't be able to do the scene right. If you know, if people have really high doses of Botox, they will barely be able to move their face. And if you see someone who can barely move their face crying, they don't really look like they're crying, because the face isn't moving properly. And I think there was a person on Selling Sunset, like the last season, that everyone was like doing memes on social media about. But but to me that would be considered treatment failure. So I don't want patients to not be able to express themselves, because expressing yourself is a really important part of how you communicate in body language. And it's really interesting, because there was an episode of Diary of CAO recently where they had a body language expert talking about how Botox can make you feel as well. And so there's some evidence that shows if you have your frown treated with Botox, you can feel more happy, because you frown less, and so that actually makes you feel more happy and less angry as a result.
I seen
And it's
this, and I actually went
yeah,
and read the study on this, because now
yeah.
Botox is being used in anger management.
Exactly, yeah.
Wow.
And
Yeah.
conversely, though, if you have, so we put Botox around around the sides of the eye. It treats this muscle called orbicularis oculi, which is this like muscle that wraps around your eye and scrunches it up tight. And so we inject it here when we're treating the crow's feet. But if you inject it so much that you can't smile properly, you know, like can't even use your face to smile, that can make you feel less happy. Because if you can't express yourself properly as a result, it actually emotionally affects you.
Wow.
And that's definitely something I would agree with that. I would say that's true. And so that is not usually the desired endpoint when you're treating someone.
And that's really interesting as well. Like, back to your point of people should really do their research and use somebody who does have extensive knowledge on this. And obviously, with your medical background, and obviously you still work within the NHS, etc. And you can tell, like speaking to you, you can tell how much you care about the mental health of the patient, thinking about, look, listen, this actually might make you sadder. And the fact that you're still so interested in reading up
Mm.
on studies and learning and, CPD, continued professional development, and
Completely.
constantly staying on top of it. And it's really important to see somebody that has that passion and love for patients and for the whole wraparound of a patient. For anybody listening, so lastly, I just wanted to say, like, for anyone that's listening who's curious and cautious like me about injectables, what's your golden rule for starting any aesthetic treatment?
Mhm. So I always tell everyone that aesthetics is a marathon, not a sprint. I always suggest starting, I say, like low and slow. So you don't have to, there are so many procedures that are available. It's massively overwhelming. It is, as far as I'm concerned, it's not your job to research or work out what the treatments are that you might need. You come to someone who's qualified, who understands anatomy, and bring to them your concerns or your problem, and it's their job to explain to you how to treat it. And you should feel comfortable with your practitioner, because these treatments are temporary. They're both the pro and the con in non-surgical aesthetics. Is the pro is that if you don't like it, it's going to wear off. If the con is that if you do like it, it's going to wear off, which means you're going to have to get it done regularly. And it is a proper journey, which requires you to really invest your time and energy into maintaining your results. And another thing I often tell is, because I'm an anaesthetist, I often talk about induction and maintenance. So induction is when we put people to sleep, and we have to give lots of drugs to do that. And then maintenance is when we keep people asleep, and we don't have to give very many drugs to do that. And it's the same with aesthetics. So sometimes getting your getting yourself to a point where you're happy and you're maintaining can cost a little bit more. But then once you are maintaining, it's much cheaper if you follow basic steps and optimize your lifestyle. And so it's that holistic understanding and knowing that you're in it for the long haul. But if you're able to commit to it, then you can get really, really good results. But you need to trust your practitioner because you're forming a long-term relationship with them effectively.
That's amazing advice. I love that bit. Basically, find the right practitioner for you. Do your research into them. Don't worry too much about what treatment it is that you need. But if you're finding that you're unhappy with something, go and find somebody that you trust, that you have done your research on. That's just great advice. Thank you, Dr. Ed, for coming on today. There's so much to take away, and I'm want to talk to you more, of course. I hope I've asked everything that our listeners would have wanted to ask. But if not, they can all obviously head over and follow you on
Absolutely.
your Instagram, and obviously they can also contact you at your clinics. But I just want to say thank you so much for being so open and honest with us. It was such an interesting conversation, and I've learned a lot.
Yeah, thank you so much. It's been an absolute pleasure. I've really enjoyed myself.
If you enjoyed this episode today, don't forget to like and subscribe to the House of Hormones podcast. Your support really does help us reach more people and spread the word about women's health. If you want to stay connected, follow us on our social media. And here's something really important. We're on a mission to secure more funding for women's health initiatives. Sign our government petition today and help us amplify our voices for better healthcare resources and support. Together, we can make a difference. Thank you for being part of our journey. We can't wait to see you in the next episode.